Hello and welcome to the Narrated slideshow developed by Northamptonshire Safeguarding Children's Partnership. The presentation is designed to be used as an aid for professionals. The Child Exploitation Risk Assessment Framework, or CERAF for short, is now being used across Northamptonshire and has been adopted from Bernardo's Child Sexual Exploitation tool, and the CERAF used across 4 local authorities in the south of England. CERAF now also includes indicators specific to child criminal exploitation, as well as sexual exploitation, and reflects our procedural requirements in Northamptonshire. 23. The CERAF is going to feed across North and West Northamptonshire, enabling us to provide a streamlined response across the county. During this presentation, we're going to look at some best practice guidance on completing the CERAF, scoring and subsequent actions to be taken. It's important that a CERAF is completed as soon as any potential concerns regarding child exploitation are identified. This could be following a missing episode, a change peer group, or an arrest for a drug-related offence. There are many indicators of child exploitation, and it is important to note that while some are common, there's no definitive list. And with many local authorities using various screening tools, there's a diverse range of indicators being used across England and Wales to identify child exploitation. We also know that the way children are groomed and exploited changes rapidly, and this is why we continually ask you to use your professional judgment. CERAF can be completed by any professionals working with children, but it is most effective when co-produced with other professionals involved in a case. It is also important to involve both the parent or carer and the child themselves when completing the CERAF. CERAF not only helps to identify exploitation, but it's a good guide to effective interventions, and so should be considered a live document for the duration we are working with a child rather than a tick box exercise. It is recommended that the CERAF should be reviewed frequently or following a significant incident or change of circumstances. But it's really important as professionals that we use our own judgment to determine if revisiting the CERAF is needed at any point we are working with a child. We also ask that professionals are mindful of their language when completing the CERAF and working with children. A number of useful guides to our use of language can be found on the NSCP website. To begin with, you will be asked to complete a front page detailing some information about the child and yourself. Once you have completed this, you will come to the first section, which is the low risk indicators or vulnerabilities. In this section, we are asking you to think about whether these factors have increased the child's vulnerability to exploitation. The CERAF guidance document gives you really useful areas to think about for each different vulnerability. For example, in breakdown of family relationships, it asks you to think about whether a breakdown may have caused the child to avoid going home or seek a sense of belonging elsewhere. There is no time frame included here in these indicators, as we are asking you to consider each factor and their relationship with the child's vulnerability, as opposed to whether it exists now. Each of the vulnerabilities has a score of 1. The next section is medium risk indicators, and this section of the CERAF includes indicators that are associated with the risk of or that may indicate abuse, criminal or sexual exploitation. You will notice that there is a time frame, and we ask you to only tick these if they have been present during the past 3 months or are current now. Again, the CERAF guidance has areas to think about for each indicator, and it is really useful to refer to these throughout. For example, when we look at regularly staying out, we ask whether the child is demonstrating a pattern of staying out late, or if there's been a recent change, perhaps they're pushing boundaries, or is it indicative of something slightly more concerning? Another example to think about is drug and alcohol use, and considering whether their substance misuse is beyond more common teenage experimentation. Are drugs and alcohol being supplied to the child as part of the grooming process, and does the substance given reduce the child's capacity to keep safe? Alongside each indicator, an area for you to give evidence of the medium risk indicators, and we ask that you include evidence for each indicator that you take and as much information as possible. So, to expand on the example for drug and alcohol use, we might ask you to think about how the child is accessing or funding a substance, who is supplying it to them, are there any indications of dependency or increasing dependency, and would they be accruing a debt? It would also be useful to have an indication of all the substances that are being used, and remember that this particular area is about the child's indicators as opposed to substance use within the family. The next area of the CERAF to complete is the high risk indicators. These indicators have been selected because they are prevalent in cases where children and young people are at risk of or are being abused through exploitation. In order to monitor changing risk over time, either as a result of intervention or change in circumstances, it is important to know whether the risk indicator is current or recent. That is why there are two boxes besides each indicator, one for if it has been present between 3 and 6 months ago, and one if the indicator is still present now. You can tick either box or you can tick both. For each indicator there will be a maximum score of 6. The guidance again is really useful to refer to, as with every other area it breaks down each indicator, asking you to consider things to help you complete this as effectively as possible. When we look, for example, at the period going missing overnight or longer, it asks you to think about details of when and what is known about who they have stayed with. You're asked to think about whether they are travelling out of the area, found in another area with no obvious link, because this could be indicative of county lines risks and trafficking. And it's important to provide details of how often this has occurred and the duration of missing episodes, as well as any other known details. It may be that there are occasions when a child is missing overnight and it is completely unrelated to exploitation. However, it is still probably appropriate to include this within CERAF, because it is always important to consider it as an indicator of exploitation. As with the medium risk indicators, there are boxes besides and underneath this section, so you can put as much evidence in as possible. For each indicator that you have ticked, please do ensure that you have as much information. And one of the really important things within this is, even though we have ticked whether they are present between 3 and 6 months ago or present now, is to include dates, as this is really crucial in building a picture of what that child might be experiencing. Once you've collected all the information you need from multiple sources and completed the low, medium and high risk indicators, ensuring you have provided as much information as possible in the boxes, you are now ready to move to the next part of the assessment. Here you will consider protective factors and strengths, as well as safety measures and disruption. The presence of protective factors may reduce the level of concern about current risks. Conversely, a lack of these may heighten the concern. You may think about whether the child has any positive relationships with protective adults or supportive professionals, or whether they have positive and pro-social peer relationships or sustained access to diversionary activities. There may be some ongoing work with the parents and effective parental oversight, and there could be some community or police action that disrupts some of the risks. You are asked then to consider both the child's and the parent care reviews and the perceptions of the risks. When there is a potential perceived risk of exploitation, conversations with both the child and the parent carer should take place to explore this. It is acknowledged that these discussions can be challenging, but it is crucial that they take place and are recorded. While some children may respond positively to the physical form, others will not, and it is acceptable to reference concerns on CERAF and record their views from conversations rather than expect them to complete the CERAF alongside you. Gathering the child and the parent care reviews adds context to any concerns and enables professionals to understand the impact that those risks may have on the child's overall safety. Does the child recognise risk, for example, do they express that they feel both safe and in control? It is important to reflect their views, even if they differ from yours, and explore a child's perception with them enables us as professionals to understand how they're framing their exploitation, and this in turn will enable the most effective approach and interventions to be put in place. When exploring risk with the parent carer, do they minimise missing episodes, for example, as this will have an impact on the child's views and actions and may be increasing the risk posed to the child? Or are they taking all appropriate protective steps, and if so, is this having any impact? You will notice that you're asked to list any relationships, peer groups, locations or settings that you think may be linked to exploitation risk. And again, as much detail as possible here, because this will enable professionals to create a safety plan and consider any immediate actions needed to increase the child's safety. Once you have completed the previous sections of the CERAF, you will come to the scoring and professional judgment boxes. Scoring is achieved simply by adding the scores from each vulnerability and indicator together. Remember, it's 1 point low, medium and high risk indicators present within the last 3 to 6 months. 5 points for any high risk indicators present now. For any child aged under 13 with at least one high risk indicator present, a further 5 points are added to the total score. You will then use all the information you have gathered, including protective factors and safety measures, and the child parent carer reviews to assist with forming a narrative around what the child may be experiencing, and will record this in the professional judgment box using the helpful prompts as guidance. You are then asked to determine the level of risk to the child. You will notice for each risk level you are given a score guideline, and this is because your professional judgment may override the CERAF score. You could, for example, have a CERAF score of 11, but one high risk indicator present that is significant in relation to child exploitation risk in your opinion. So this would be explained in the professional judgment box and reflected in the risk level you select, which you may believe sits in the high risk category rather than medium. Remember, the risk level is not determined by the score. The score is a guideline, and it is your professional judgment that is crucial to identifying child exploitation risk. It's important when we consider exploitation risks that we are also alert to the potential the child might have been a victim of trafficking or modern-day slavery. Once you have stated your professional view at the level of risk posed to the child, and whether you believe the primary risk to be CE or CSE, you'll be prompted to consider whether there are reasonable grounds to suspect the child may be trafficked or a victim of forced labour. If there is a reason to believe they have, this is a child protection issue and needs referring into the multi-agency safeguarding hub or raising with the child social worker if one is already allocated. Together, Children's Services and the police make a decision whether an NRM should be completed. This decision will usually be made following a strategy meeting so that all the relevant information can be gathered. Unlike a CERAF, only designated professionals can refer a potential victim of modern slavery into the NRM. For children, this is most commonly the children's social care professionals or police. Details of who qualifies as a first responder are available through the link on screen, and as you will be first asked referral details, you won't be able to progress with completing the NRM unless you are recognised as such. Once you have completed the CERAF, you can refer to the risk categories associated actions alongside. You will find this at the bottom of the CERAF document itself, and this is a useful guide to understand what action you need to take next. Whenever a CERAF is completed for a child, it is also important that the allocated social worker or lead professional is notified and can share their views. The CERAF should be shared with them regardless of the outcome. Any young person recorded with a medium or high risk outcome should be referred immediately to MASH. MASH will then screen this referral and determine whether no assessment and strategy meeting needs to be convened by the duty and assessment team. Once the risk level has been identified, which will either be low, medium or high, this will trigger a pathway. So starting with low risk young people, this would not normally meet the criteria for a MASH referral for concerns that relate to exploitation on their own. However, it may be helpful to consider initiating early help processes so as the team around the family can develop a preventive plan. For children who are already open on child protection plans for non-related exploitation reasons, who are already looked after or subject to early help processes, then the allocated social worker or lead professional will need to ensure that there is a multi-agency response to the child exploitation concerns, and any preventative intervention is blended with their existing early help, child protection, child in need or child in care plan. For children identified as medium risk, a referral should be made to MASH if that young person is not already open to children's services. MASH will rescreen this referral, and if it is still considered to be medium, the young person will be transferred to the duty and assessment team, child and family assessment to be completed, and a strategy meeting to be considered. The child exploitation element of a child in need or core group meeting will be chaired by the social worker, and this will be recorded on one single plan. For children in care, additional standalone meetings will be held every 4 to 6 weeks in addition to their looked after reviews. The initial meeting for medium risk young people should be chaired by either a team manager or advanced social worker. The child exploitation assessment should be reviewed and updated 4 to 6 weekly, and a discussion should be held with a team manager before any review meeting to agree a reduction to low risk. For some medium risk young people, it may be proportionate to be managed by children and family support services or a lead professional through early help processes, following a child and family assessment being completed by the duty and assessment team. A joint threshold decision would be required for this between early help services and children's services. Young people considered to be at high risk, they should again be referred to MASH if they already don't have a social worker. MASH will again rescreen, and if it is still considered to be high risk, the young person will be transferred to the duty and assessment team, and a strategy meeting will be urgently convened. The CERAF assessment should be reviewed and updated every 4 weeks by the allocated social worker in partnership with the multi-agency team. A child exploitation high-risk meeting should be held every 4 weeks, but this should be combined with a core group meeting or child in need meeting to prevent duplication. For children in care, additional multidisciplinary meetings should be held. For high-risk cases, the team manager or advanced social worker should chair these meetings. At 3-month intervals, an independent conference chair or independent reviewing officer should chair the review. The very last bit of information on the CERAF is the link to the CERAF guidance and all other documentation associated with the tool. This includes more detail around each individual indicator. It is recommended that all CERAFs are completed using the guidance as a reference. You will also find email addresses for teams where you can contact someone for support or guidance if needed. This concludes the short presentation on the CERAF, and thank you for watching.